Need to add something
Very
about
quickly,
pharmaceutical. Very quickly.
yeah.
Much of the out-of-pocket expenses of patients are paid for drugs. Unfortunately, there's a fundamental flaw with our regulations, wherein the National Drug Formulary drugs are covered also by PhilHealth, but depending on what drugs are chosen by the hospital, PhilHealth will pay for whatever is chosen, which means that there's no equity. If we restrict the National Formulary to essential generic drugs, then we could leverage what is needed, cover the population, and not spend too much.
Thank you very much, Dr. Go. We'll take a question from UP Mindanao, and then we take one or two more questions from the floor. We're coming close to the end of our forum. UP Mindanao, Mr. June Mantequilla, please come in.
Okay, good afternoon. I would like to ask the question to Dr. Go. I knew of a medical doctor who was hired of a food supplement company to test its product on mice. The results show that all mice taken in food supplement developed hepatitis. She's now having dilemma how to explain the results to the owner. Do DOH and BFAD have the power to sanction the company, even if they do not divulge the results? Do we have safety nets for consumers who are using the products that claim no therapeutic effect and yet harmful and is well distributed already in the market? Another related question, how do we go about resolving problems on misinformations brought about by massive advertisements of drug or food supplement companies?
Excellent question.
Thank you for your question. I'll address the first question. BFAD needs to have those materials to be able to act on it. Now, if the doctor has signed a confidentiality agreement, we have to respect that. He cannot divulge the results, but he has to come clean and tell the owners of the company what he found and maybe come up with a scientific postulation on why there is toxic hepatitis. Now, because this is a serious thing, no? Imagine it leaking out to the consumer and using it, you get a host of these kind of problems. Now, the second part is that there is a system called post-marketing surveillance. Meaning to say, if a product is already out there, consumers can report what they find to their doctors, and the doctors report it to their regulatory agency. Unfortunately, we don't have that level of maturity where doctors would come forward and report their findings, adverse reactions or toxicity. We need to encourage our professionals to do that. Now, how do we then, your second question has something to do with countering misinformation.
Yes.
I'd like to call my colleagues in the medical profession, we need to step up. What we find, we must tell the public. We cannot be insular and keep this information to ourselves.
Can you give a concrete example, Dr. Go?
Right. We've heard of this situation where certain food supplements are causing some toxicity, but we hear it word of mouth. In conferences, we share this data, but nobody has the guts to come forward and write up those case studies. You see, for a regulatory agency who's undermanned, understaffed, and underfinanced, they need to get the cooperation from the public health from the private health sector who are seeing these patients suffering from this kind of toxic consequences. They need to step forward, write it up, publish it, share it, so that the government will be in a position to act on it. I mean, we often complain that government don't act on it, on certain, because they simply don't have the data. But of course, if they do have the data and they still don't act on it, that's a completely different story.
Okay. So the label which says no therapeutic claims does not excuse the producers of this health supplements.
What I think the Food and Drugs have to do is say, this drug has not been evaluated, has not been tested, consumers use it at your own risk. That's what they should
yun
say.
Ang maganda. Consumers
hindi yung
use
no
it at their own
therapeutic
risk.
because it doesn't mean anything. You know?
Hindi yung no therapeutic claims,
They
tapos
say,
tatakpan
it
yung
is a
no.
ito hindi, in vernacular, ito hindi pinag-aralan, hindi pinasurian ng mga dalubhasa. Kung gagamitin nyo, bahala kayo sa buhay nyo. That's what they should say.
Yun ang magandang ilagay. Go ahead.
Just to follow that up in this misinformation. A blatant lie I can take, but a half-truth is worse. I'll give you a good example. If I tell you that pwedeng magpababa ng blood pressure mo ang bawang, I'm stating a truth. Okay. That's a medical fact. Pero pag tinanong kita, para bumaba ng 2 punto ang blood pressure mo, ilang bawang ang kakainin mo?
Ilan?
3. dalawa lang ang bababa. Kung 150 blood pressure, 140, tatlong bawang na yung nakain mo. Kung gusto mo yung normal na 130, di isang tiklis na bawang yon. So, that's really bad. That is very bad. Because you
It's a
are
half-truth.
peddling a half-truth.
Tama. That's right. Thank you very much. Yes, we have a lawyer here, the University Legal Counsel, Attorney Te.
Good afternoon. I'm Attorney Te from the UP system. I was just struck earlier by Professor Domingo's question that if someone has a right violated, she or he has a recourse.
Right.
And we're talking about universal health care. But while I was listening to all the presentations, I was thinking these are the components of a national policy or an agenda on health.
Correct.
And the Constitution ensures that there is a right to health. To my mind, a right to health may consist of healthcare, universal healthcare, but it may also consist of people not getting sick. Meaning, is there a national policy that would make sure that we don't get sick, that environment is kept safe, that, for example, I have a particular bias against tobacco, that people don't smoke. I don't get secondhand smoke. There are specific scattered laws on tobacco, on hospitals not refusing indigents. But to my mind, all of those should go into a national health policy.
Right.
We have a national defense policy. We have an IT policy. But do we have a national health policy? And if we do have a national health policy, what does it consist of? And do you agree with it? And what do we need to change about it?
Great question. Could you please? That's a great question.
About whether we have a national health policy, I cannot answer. But what you said is, what you said is this, that in preserving health, let us not look at medical intervention or drug. Because the best thing we can do to preserve health is a lifestyle modification. I'll give you one very concrete example. And here you'll see where we doctors participate in a very negative way. If I ask anybody, paano hindi ka magkakaroon ng heart attack? Sasabihin sa'yo, iinom mo ako ng anti-cholesterol drug dahil mataas ang cholesterol ko. Okay. Actual study, and this is Professor Antonio Dance of UP, has shown very conclusively that when you have different risk factor for heart attack, namely high blood pressure, diabetes, high cholesterol, do you know the single most dangerous, 11 times more risky than all these things that you are worried? Smoking.
I see.
Do you need drugs to protect your heart? What you have to do is stop smoking. And there are many others, like you walk a lot, do exercise. And what do we doctors, what are we doctors really emphasizing? Kung magpa-executive check-up ka, mataas ang cholesterol mo, aminom ka ng statins. Hindi mo sinabi, lugar na statins sa bababae mo, minto ka na lang ng
Paninigarilyo. Okay.
That's it. So,
Dr. Flavia.
There's importance regarding medical and health professionals giving information. But regarding the question of national policy, it's more evident in national action rather than articulation of law. And the concrete case in this administration is, while all of us keep insisting on the harmful effects of tobacco, our president inaugurates a tobacco manufacturing company in the Philippines. So there's this market versus health balance. And that's the same thing with information. When 24 hours of the day are paid for by sponsors who can sell certain products based on the advertising that is put there, I have to thank networks who give us 1 hour of the day during 12 o'clock midnight when everyone is sleeping for free health education. But the point goes down to information and health costs money, and those who have the money tend to be able to influence national policy.
Go ahead. Okay, we'll take just one more question from the floor. No?
Good
Nandito na
afternoon.
siya.